Okay, so now we're going to get into the conditions. So basically we talked about the different anatomical structures. We started with inert tissues. We had bones, ligaments. We didn't really talk much about the joints, but basically what are the kind of conditions that you have that affect joints when we're talking about articular surfaces? Yeah, DJD. So people can have DJD of the ankle. They can do ankle replacement surgery, just like they do for the knee or for the hip. So then we moved into contractile tissue, and there you're going to have, like you can have Achilles tendonitis, you can have different tendon problems. We talked about the neuro stuff. You have the tarsal tunnel, and then vascular, you have the deep veins in the calf. And then we talked about range of motion. You have plantar flexion, dorsiflexion, and then the subtalar joint, which is where you have pronation, supination, or inversion, eversion. So then, now going through the usual sequence, you have inert tissues, things that affect the bone. What's going to happen to the bone? The fracture, is that going to be mostly acute, right?
Yeah.
You can have stress fractures. Sometimes they'll occur in the tibia. So when we talk later about shin splints, one of the differentials for shin splints could be a stress fracture. But a lot of times you have ankle injuries where you have what the mechanism of a sprain type of thing. You can also have fractures that go along with it. So here you can have fracture of the distal fibula. You can get fractures up here into the tibia. You can have the typical like Joe Theismann type of injury where it goes through both of them, tib fib. I think one of the videos I had on there was one of those. You can have a compression fracture of the calcaneus. If somebody falls from a height, they land on their feet, you can get compression fractures in the spine. You can also get them in the heel. I think. So now we have ankle sprains. You can either have what's regular ankle sprains, which most commonly, like we said, is on the lateral side. Most commonly it's going to be the anterior talofib. And when you talk about, so then lateral, and then medial is going to be, what's the ligaments on the medial side? Deltoid. Okay. And then high ankle, when we're talking about high ankle, this is what we're talking about right here. Anterior, inferior, tibiofibular ligament. Okay. Now, which type of mechanism of injury would separate that ligament? Extreme plantar flexion or extreme dorsiflexion? Which part of the talus is wider, the front or the back? So what's going to force the ankle mortise apart is dorsiflexion. So it's going to happen usually in close packed position, which is dorsiflexion.
So Bob, I have a quick question. So why don't they call it extension and flexion? Because it seems like everybody, even people that know what they're talking about, always screw up dorsiflexion and plantar flexion. It's like, let's stop for a second, but which one is which? You know what I mean?
Yeah.
What's wrong with extension and flexion?
Sometimes I get confused between flexion and extension. It's easier for say plantar flexion because I know the plantar aspect of the foot's going down and the dorsal's going up. But you kind of have to know it both ways. I don't have an answer to that. But usually, flexion is usually when you get into the fetal position. So that's going to be that. And they also think of it as flexion of the toes, something like that, extension of the toes. So this would be, extension of the lower leg. This would be flexion of the lower leg. So you just have to know both, basically. All right, so now I'll talk about lateral ankle sprains. So typically it's the thing where they roll onto the side of the foot. So where are they going to have the, where are they going to have the pain and the problems? Lateral. Good. So you can have the tearing of the ligaments on the lateral side, anterior talofibular, posterior talofibular, calcaneofibular. All right, so then you can have associated fractures that can go along with that. The distal part of the fibula can get broken off. Remember we talked before about avulsion fractures where sometimes the ligament's so strong that the ligament doesn't tear, that pulls the bone off with it. So you'd have avulsion fractures on this side, then you could also have a fracture on the other side from like a compression type of thing. Yeah, so compression fracture of the medial malleolus, and then osteochondral fracture of the superior lateral dome of the talus. So then the mechanism, the history, they're going to say, well, I twisted my ankle, I felt something pop. Same type of thing with ligament injuries. So then, so they're going to have tearing here. This would be the high ankle sprain, but they can go together. You can get high ankle sprain plus anterior talifib. So here's the test. Let's see here. It doesn't show so much where it's on the soft exam table, but when I pick the ankle up, you can see right here that we're looking right there. You see how the talus is moving in relation to the fibula? Okay, so that's the anterior drawer test. There's a couple other ones we'll talk about, Taylor tilt, things like that. See, maybe I just put one of these on. So typical inert tissue sprain type of injury. Tearing the ligaments, you can have different grades where you have grade 1, grade 2, grade 3. Grade 3 would be like this where you're completely severing it. So you have an acute phase where you might be treating somebody that has an acute ankle sprain. They're going to have swelling, so you do needling and different things. Or you're going to have a chronic type of situation where they've sprained their ankle a bunch of times and they just have a loose ankle. So now you have medial ankle sprain here where you have a deltoid. And then I think I was mentioned before, that's when I did that at the same time when I did my knee where I had the ski that caught out like that. And I was focused so much on the knee that I didn't realize till later that the deltoid went out too. And then now in this case we almost have the kind of complicated injuries are the reverse of the other side where you can have avulsion of the medial malleolus, compression fracture of the lateral. I mean, it's not a true compression. It's more compression as a mechanism, but it's more of an acute fracture where you're going to because you can get an avulsion here on the lateral side. So this is the big toe side. So you can get, wait a minute, I'm sorry. This is the big toe side. So this is medial. So you're going to have avulsion on the medial malleolus, and then you can break the lateral malleolus from getting forced up into it. Then you have a high ankle sprain. It can happen with inversion or eversion and internal or external rotation. But it's also, like I mentioned, forced dorsiflexion because dorsiflexion is where it's going to spread the ankle mortise. And again, these can happen where you can injure more than one ligament at the same time. Obviously, high ankle sprain, they're going to have pain going higher up the ankle. And then again, you can have the associated different fractures. You can also have a spiral fracture where the fibula gets kind of twisted and you get a spiral fracture going up the thing, kind of like a barber pole.